Today is day 4 of spay. A 1-year-old female Norwegian Persian cat was on heat when she arrived at the clinic. On the 31st of July, she was admitted by Dr. Singh Kongen. He advised 4 days for the cat to go off the heat period. As 1, the cat was caterwauling at home, and 2, there will be less bleeding during the spay.
Okay, caterwauling means that the cat makes a lot of noise wanting to go out to mate, and nobody can sleep because the noise is really loud, like the cat was being beaten up by the owner, and so the owner phoned me, and I advised that they can either spay the cat on the same day as they call me, or you can wait 4 days when the uterus and the ovarian blood vessels are much thinner and there will be less bleeding, because the heat period there's a lot of bleeding when we spay a female cat. We continue.
On the 3rd of August, we started the spay procedure with an IV drip. Then we sedated the cat with xylazine and ketamine. Cat was maintained on gaseous anesthesia with isoflurane. During the surgery, the vet used a spay hook to take out 2 ovaries and 2 uterine horns. The vet then sutured the skin and muscles with 2 stitches using Monosin 30 absorbable. After the surgery, the cat was put back to the cage to wake up from the anesthesia. Cat is given antibiotics and painkillers. On the 3rd of August, the cat was ready to go home.
On the same day of the spay.
Yes. However, the owner could not administer the medications to the cat and did not have the means to. Hence, the owner brought the cat back to the clinic for boarding so that the nurses here can feed the medication for the cat so that proper healing will be allowed.
Okay, also the nurse need to change the bandage. There was a bandage covering the operation site. How many days was it on?
3 days.
3 days. The owner couldn't do it, so the cat was here, and the bandage is a plaster actually, was taken out before this videoing. And also, did you mention about sedation?
Yeah.
You did, no? Okay, then so as you can see, what's the temperature today?
38.5.
38.5, and the cat looks very well. Is still on antibiotics and painkillers, right?
Yeah, oral medicine.
Oral medicine. Check the gum and see how's the gum. Appetite is good.
She's a bit stressed, so not eating too much like the normal, but finish overnight.
Open up. Open the mouth a bit. See the gums are pink, and see the eyelids. And so this cat, how old is it?
1 year old.
1 year
It's in good health. No, the eyelids, yeah.
Cannot see.
Can we see? Is it pale?
No,
Actually, you can't see it.
it's black color. Cannot see.
The ears are okay.
Yeah.
What's the purpose of the ear collar?
To prevent leaking from the wound and biting the stitches.
To prevent. Is it effective?
Yeah.
So you turn one more time, upside down. Now as you can see, if there was infection, this part would be all reddish, and the wound healing, this is only 4 days or 3 days?
Today is the 4th day.
The wound healing wouldn't be so clean. You see the ends of the skin had been closed by 2 stitches. This is called simple interrupted sutures, and actually from now we wouldn't be putting on the plaster anymore, and the cat should recover very well. Takes about how many days? Another
7 days.
Altogether 7 days, huh? And as you can see, there should be no more problem. Now, most owners, they spay the cat because she is making a lot of noise, and nobody can sleep, and the neighbors are not too happy, especially in apartment living. Also, some cats might even run out, escape, and become pregnant. So it's always best to spay the cat early. Now this cat is a bit thin. You can feel do you feel the bones?
No.
Spinal bones, you can feel it. So the cat need to have more food at home. Any questions? No more. So we shall conclude the presentation. Temperature is okay?
Yeah.
Okay.